All right, so let's talk about the second part of our upper respiratory system, which begins with the term pharynx over here. And I'll use this side for our larger imaging. So pharynx is a pretty funny word. It's just it has a ph in it. It's got a ynx ending. It's a weird one to spell. So luckily, you won't be spelling this word in our quizzes because it'll be presented as a multiple choice question. So that's always the little things to be happy about. But pharynx is kind of how I remember how to spell it, but that's not even totally correct. It's a very hard word to say in a phonetic way. So pharynx, take a look at it. That's how you spell it. And so let's talk about what it is. The pharynx is the layman's term for it is your throat. So if you have a sore throat, that's a general way of saying you've got probably some inflammation causing some pain in your throat, and that's your sore throat. So pharynx and throat are roughly equivalent. Both are general. So in this class, what we're going to do is be more precise, like we usually are with the anatomy of the human body. So the pharynx, if you look at this picture here, we've already gone over the nasal cavity, which you can see in green. The nasal cavity is not part of your throat. The throat begins posterior to the nasal cavity, but superior to the mouth. So there's this area here in blue, that's part of the pharynx. In purple, that's also part of the pharynx. And in, teal, that's also part of the pharynx. It breaks down into three categories labeled here: nasopharynx, oropharynx, and laryngopharynx. And the names are really easy to remember, hopefully, because they're related to where they are. The nasopharynx is closer to the nasal cavity. The oropharynx is near this oral opening here, near your mouth. And the laryngopharynx is down near the larynx. So they are a little bit different, though, some of the structures that are inside of them. So we'll start from top and work our way down to the bottom, just like your list over here. So the nasopharynx is really a continuation of the nasal canal from the point of view of what kind of tissue is lining it. So it still has ciliated pseudostratified columnar epithelium. It also has something called tonsils in them. And tonsils are essentially collections of lymphatic tissue where white blood cells live. And they're near openings in your body that are exposed to the external environment. And so your mouth is a really good example of a place where we have tons and tons of tonsils. And we're going to talk about each one of them. I'll go to a different picture to show you the pharyngeal tonsil. Oh, let me reload this page because I added this image in recently. There we go. So the pharyngeal tonsil, I think this is a tonsil picture, and so you can see it here. And so it's just posterior to your nasal canal. It's bumpy in reality because these are these little things called follicles. They're made of reticular tissue, and there's just a ton of white blood cells sitting there waiting to catch anything that you breathe in, basically. That's what that pharyngeal tonsil is doing. So if we look at our other pictures here, pretty easy to pick out. The pharyngeal tonsil, which is in, again, the nasopharynx. So it's that little white thing in this picture. This picture also shows other tonsils. All of them are kind of white here. But let's go through and name each one of them while we're talking about tonsils. So up here, the tonsils are in a couple different categories. So we'll talk about the palatine, the lingual, the pharyngeal, which is what we're talking about now, and the tubal tonsils. So 4 total tonsils. That's why there's 4 names here. So pharyngeal tonsil, you're always going to see it right up here in any of the pictures. The tubal tonsil is a little tricky. It's also in the nasopharynx. It is not very large, though. And where it is actually up inside of your pharyngotympanic tube, also known as your eustachian tube. So that's what that opening is. So you don't get these nice bumps in any of the images because in reality it's such a small and deep tonsil that you don't see it so much unless it's really inflamed. And so those are your 2 that are in the nasopharynx. The pharyngeal tonsil, easy to see, big and kind of on the back side of the nasopharynx. And the tubal tonsil, which essentially is just the only tonsil that's near the eustachian tube. So you basically just point at the eustachian tube, and that would be the tubal tonsil. And then moving down into the oropharynx, this is where we have much larger tonsils because the things we eat are disgusting. Basically covered in bacteria, have all sorts of things that could potentially hurt us. So we've got a lot of tonsil mass back here. So the palatine tonsil, it's called the palatine tonsil because it's on your soft palate. basically just on the posterior aspect of your soft palate. And then the lingual tonsil is the one where when you stick your tongue out and go, ah, you're revealing or exposing your lingual tonsil to someone who's looking into your mouth. And so above, basically, you've got the palatine tonsil. Below, you've got the lingual tonsil. And then way above, and also able to protect you based on things you breathe in, is your pharyngeal tonsil. And so you've got those three big bad tonsils. Actually, they're really good, but they're big. And then the little teeny tubal tonsils sort of hidden up there in your eustachian tube. So those are your 4 tonsils. All right, a couple other terms here. We left out otitis media, which is a fancy term for a middle ear infection. We've already gone over the ears, so you remember the pharyngotympanic tube, which is where you'll find the tubal tonsil. That leads up into the middle ear, so behind the eardrum, but in front of, or I guess superficial to, the inner ear where the cochlea is. And so this is why you have this interplay between infections in your sinuses potentially. So here's your sphenoid sinus and frontal sinus, which connect to the nasal cavity. Those, you can have sinus infections affect your middle ear because you have a physical connection between the nasopharynx and the middle ear. And so otitis media is just a middle ear infection. Couple other terms here. Fauces. I'm not totally sure how to say that. I've literally never heard anybody say this term in reality. But basically, it is exactly what it says here: the posterior opening to the oral cavity about it. And then the uvula. This is the thing that hangs down in the back of your throat right here. So it's real easy to see from this perspective. It can be a little trickier here, but it's labeled off to the left side of this image, and it's pointed to right there. So that's the uvula. When you swallow something in your mouth, the muscles of your soft palate constrict, and the uvula closes off the nasopharynx from the oropharynx. So isn't that nice to know your anatomical terms? It just makes it so much more concise to describe things. So one more time, even since you're just learning these terms, the uvula basically swings back when you swallow in order to create a soft tissue barrier between the nasopharynx and the oropharynx. That way food hopefully doesn't go down up into your nasal cavity. But if you've ever eaten something and then coughed, the pressure is high here when you cough, and the pressure is relatively low there, so you can definitely blow things past it and into your nose, and it doesn't feel good. And then the last term is stratified squamous epithelium. That's what you transition to tissue-wise. You basically transition from that ciliated pseudostratified columnar epithelium, and it's labeled twice here: stratified squamous epithelium and stratified squamous epithelium. That's just saying that that's the tissue type in the oropharynx and the laryngopharynx. And that should make sense because stratified squamous epithelium is the thing we use when there's abrasion, when we know this tissue is going to have something rub up against it. We use stratified squamous epithelium. Whereas ciliated pseudostratified columnar epithelium is the epithelium that we line our respiratory cavities with. And that's really what this is supposed to be up here. You're not supposed to have food up here. You're not supposed to have abrasion. Occasionally it happens, but the tissue in the nasopharynx is ciliated pseudostratified columnar epithelium. So I do want you to know those different tissue types. That would be an example of a conceptual question I might ask you. What kind of epithelium is found in the nasopharynx, oropharynx, or laryngopharynx? Uh-oh, my daughter's interrupting us, but it's a good time, actually. She's ready to go down for a nap. Can you say hi?
Hi.
Hey, Mila. All right, that's it for the part 2 of the upper respiratory system.